Hi friends, let's talk about cardiac versus non-cardiac chest pain. Whenever you have chest pain, your doctor or your cardiologist looks at some very specific pointers to help assess whether your pain is coming from the heart or something else other than the heart. So let's look at a few things. The first thing is the quality of the chest pain. Chest pain that is described as pressure-like, heavy, deep inside the heart, or as if an elephant is standing on your chest is usually cardiac chest pain. On the other hand, sharp pain, stabbing pain, pain that feels like burning sensation is usually non-cardiac. But remember, there can be overlapping features as well. Number 2, we look at the duration of the chest pain. Non-cardiac chest pain can last for a few seconds. It could last for 1 to 2 minutes, or it could last for many hours at a stretch. Let's say 5 to 6 hours constantly. So that's usually not cardiac chest pain. Cardiac chest pain usually lasts from anywhere from 5 to 20 minutes. But remember, if you are having a heart attack, then the pain can actually last longer and get worse, which should prompt you to seek medical attention. Let's talk about radiation of the chest pain. So cardiac chest pain patients usually complain of radiation of the pain to their left arm most commonly, but patients can also have radiation to their right arm, their neck, jaw, as well as in the back between the shoulder blades. However, the radiation of non-cardiac chest pain can be diffuse or it may not radiate at all. Number 4, cardiac chest pain is usually not reproducible, meaning that if you have a pain at a particular point in your heart and you press on it and it hurts more, that means the pain is not related to the heart and is usually due to a trauma of the heart muscle or the bone. Also, it's less likely to be a chest pain of cardiac origin if it occurs immediately after eating. If you have something oily, fatty, or a heavy meal and you start having chest discomfort, it could be gastritis or due to gallstones. Another feature is what causes the pain or what brings about the pain. Cardiac chest pain is usually predictable, meaning whenever you exert yourself, or let's say you go for a walk or a run, and then you have this chest discomfort, it could be cardiac. Also, when you stop, when you rest, the pain goes away. Again, that points to the fact that it could be cardiac chest pain. Now, the stress could also be emotional. Let's say you have the chest discomfort when you have anxiety or you were super angry because of some reason and you had chest pain. That could also reflect an issue with the blockages in the heart. On the other hand, non-cardiac chest pain is usually not related to exertion, meaning if you walk or if you exert yourself, you shouldn't really have chest pain. Now, you can have non-cardiac chest pain with exertion if you have, let's say, pulled a muscle or you have an inflammation somewhere, then that particular area might hurt if you are pulling the muscle during exertion. Also, let's talk about what relieves the chest pain. If you have cardiac chest pain, then the relief you will get would either be when you rest or when you take a medication called sublingual nitroglycerin, which dilates the blood vessels. The pain usually does not respond to Tylenol or ibuprofen. On the other hand, a musculoskeletal pain, meaning pain due to muscles or bone injury, can get better with Tylenol or ibuprofen or antispasmodics. So friends, this was a brief review of cardiac versus non-cardiac chest pain. Whenever you are concerned that you are having chest pain, make sure you consult with your physician and undergo the appropriate diagnostic testing to help you arrive at the right diagnosis and get the right treatment. Thank you.